Good morning, everybody. I get to talk about the clitoris. How do we find it in 7 minutes or less? Now, my big disclosure is that if you want to hear more than 7 minutes about the clitoris, please come to ISWISH. We do a lot of courses, meetings, all of those things. Is there a time? Oh, man, I'm so short. All right, here we go, because I can't see the timer. And it looks like they gave me a little bit more than 7 minutes, which is excellent. Because what I will say is if I only get 7 minutes to talk about the clitoris, I want to talk about it. I have some feelings about it. I want to spend some time letting you know what I know about it. But y'all are only going to give me 7 minutes. So what's going to finish first? Me or the SMSNA? That's what I want to know. Are you guys going to finish before me? And my guess is yes. And what does the data show? Well, that it really doesn't matter, right? You cannot diagnose what you do not look for. And we as a society have really not looked at the clitoris at all historically, which is why we don't know very much about it. You gotta joke, because otherwise I would cry every single day with just how far behind we are. So I did a Google search at the airport, and I went to PubMed, and I typed in clitoris. And in the history, since 1801, there have been 2,725 articles about the clitoris. In fact, the most articles a year was in 2022. There were 112 articles about the clitoris. And as you see, number one there is Helen O'Connell, a fellow urologist who really helped to put the clitoris on the map. So I did the same thing for penis, and lo and behold, we've got 55,565 articles. And in 2020, many of you participated in making sure there were 1,736 articles about the penis. So where are we going wrong? Well, if we go back to Netter, we get a whole page, the penis, right? And we get the female perineum and deep perineum, and we get a little blip here, right? Oop, I gotta go back. I don't have a thing. You get a little bit of snippet of the glands of the clitoris there. And then you get a page that says the female perineum and the external pudendum. Y'all, pudendum in Latin, what does it mean? Shame, right? So you get a whole page on the penis, and I get a shameful organ right up there. And this actually was highlighted in the New York Times by a wonderful journalist who helped to put clitoris on the map about how that terminology, right, that pudendal nerve, which we use for all genders, but apparently the vulva is termed the pudendum. And she put us all on the map when she did a viral article in 2022 called Half the World Has a Clitoris. Why don't doctors study it? Which highlighted many of our research on the fact that we're really far behind, and certainly got the people talking about the clitoris. So these are private parts, right? These are private parts that we really shouldn't be talking about. We're mechanics. When we look under the hood with women, we hide them from their own body parts. Y'all, do you have a sheet when you see your male patients and you say, pull down your pants, take down your pants and underwear, let me just, turn your head and cough? You don't have them over a sheet. Everybody's looking at the genitals. You're talking about it, and those guys coming in with those little veins, what's this, doctor? Matt Ziegelman, can you help me with this indent here, right? So we hide by keeping our patients modest, right? We hide them from themselves. We are not mechanics looking under a hood. So why does this matter? Well, it matters because we don't have enough basic science in this area. It matters because we don't have enough clinical research in this area. There's a lack of education and cliteracy, or advocacy, if you will. How about pleasure, right? Pleasure is kind of important for you all and everybody. But what about the heart? Right? Y'all talk all the time about the canary in a coal mine and how the penis is the barometer for overall health. What are the signs and symptoms of heart disease, which is the #1 killer of women, right? Well, I bet you the same story about penile anatomy is the same in clitoral anatomy, and you could probably diagnose cardiovascular dysfunction in women if we studied arousal properly. And so the wonderful ISWISH president, Linda Vignosi, has published on this to look at cardiometabolic risk factors with a focus on clitoral vascular resistance. We have several publications, not enough, so please help us on using Doppler ultrasound, just like we do for the penis, Not shockingly, it's all homologs for the clitoris. So when we look at homologous structures here, the genitals are exactly the same. So all the pathologies that happen with the penis happen in the female genitals too. It's just that we decided to study one and not the other. And so again, I show every patient I'm going to put a penile implant in, I show them this picture and tell them how their penile implant probably isn't going to make their partner have more of an orgasm or more pleasure, and really get them to understand the purpose of the device that I'm putting in. And many of them go home starting to search vibrators and devices and things like that. We know that the tissue is exactly the same as the penile tissue. It is all smooth muscle. The cross sections look exactly the same, right? That is a penis and a clitoris side by side. In fact, again, cadaver dissections show that this is a huge organ that just nobody decided to teach us about in medical school. And of course, if you look at the neuroanatomy, I was always taught it's all pudendal nerve. That's the only thing we care about is the pudendal nerve. I had to go to Instagram to find a picture of the cavernous nerves of the clitoris. This is not in any of our textbooks, right? But of course it makes sense. There's cavernous autonomic nerves to the penis. Why wouldn't there be cavernous autonomic nerves to the clitoris? It's just anatomists forgot to tell us about it. But luckily, this Instagram artist decided to do a rendition. The wonderful Blair Peters, our plastic surgeons and transgender surgeon friends are getting involved, and they published on that the clitoris has more than 10,000 nerve endings, which is larger than the size of the dorsal nerve, the ulnar nerve of the arm. These are huge nerves that you can use for grafting when you're doing transgender surgery. I got 2 minutes, y'all. I got a lot to say in 2 minutes. You're going to be left unsatisfied after 7 minutes. You're going to want more, and you're going to be disappointed. Welcome to what everybody else experiences. Disappointment's good for you. So it's important to know that most women do not orgasm from penetration. This was Debbie Herbenick's study, which showed that 18% of women report intercourse alone is sufficient. I have a theory, maybe you can help me prove it. I think these women are premature ejaculators. They're so sensitive that any light touch to their clitoris, boom, makes them orgasm. I bet you can prove the exact same homolog in male premature ejaculators to women who orgasm with penetration. And so we just learned from Jeopardy that 5.4 minutes is the average IIELT time. Well, if you give that stopwatch to the women, it's 13.4 minutes, but 17% of women never had an orgasm. And as we all know from what you just learned, penetration is not sufficient for the majority of people to experience orgasm. We know that there is a pay gap in our country. All you men get paid more than all the women in the room. But there's an orgasm gap as well. For every orgasm a heterosexual man has, which is 95% at every sexual encounter, a heterosexual woman orgasms 66% of the time. So we have a major orgasm gap as well, and it's all an education gap. We know that it's time for all of the doctors in the room. How many of you tell your patients about sexual devices, vacuum pumps, vibrators, right? We should be prescribing devices to our patients. The clitoris loves vibration. The penis loves it too. It just hasn't tried it many times. So what about, in 30 seconds, what about when things go wrong? So who is responsible for taking care of clitoral problems? I know you as sexual medicine doctors were not taught how to examine the clitoris. So do you go to your primary care doc, to your gynecologist? Who is supposed to take care of these issues? Well, so what happens when a patient comes in saying, I don't like to be touched, I have a muted orgasm, it's too painful? Well, I would tell you, but I just ran out of time. So I hope you all have a great day, and thank you so much for having me, SMS.